Very few things ever appear just spontaneously. And the depth of the neurosciences program within Riverside evolved. Most notably, it evolved from two physicians who in some way were coming home again. Dr. Bill Harris and Dr. Bill Peach, greatly assisted by the presence of Dr. Rinaldi, were actually coming back home.
The beginning of neurology, it was really, Dr. Harris, Dr. Kopp, Dr. Regan, and they did everything. They brought a skill set that was not just for Hampton Roads, but really was for the entire state, if not for the region. Think about the beginning of neurosurgery at Riverside. We were so fortunate. We had Dr. Peach, Dr. Rinaldi, Dr. Garner, just incredible gentlemen in terms of not only their physician skills, but also, how they served in the community. Maybe the only time they weren't quite as dedicated, like when Dr. Kopp wanted to play one of his many rounds of golf. He is quite the golfer.
Although I certainly never sailed with Dr. Peach, everything I've ever heard was that you knew how methodical a neurosurgeon he was based on how methodical a sailor he was.
In late 2004, there were several departures of the neurosurgeons in the area. And so Dr. McAllister and I talked with Riverside, along with Dr. Garner, and we became part of Riverside then. And I think it was wildly successful.
I can assure you many of the physicians that are in place today have a great deal of respect for the physicians that came before them. As Riverside Medical Group was evolving, it quickly became clear that Dr. McAllister held Dr. Garner in great esteem and wanted to be absolutely sure that his contributions were noted and continued to be well utilized.
As things have evolved and developed within neurosciences, there were different turning points. I would say a turning point with Dr. Regan and his involvement was when he had us start what we call the Neurosciences Case Conference.
The only time you would really see neurologists and neurosurgeons get excited and almost look like kids would be when Dr. Regan was doing a brain cutting. And every now and then you would go past the room where he was doing this presentation and the room would be packed. And that kind of nurturing from generation to generation, that's part of the reason that we are here today.
The other thing I think with turning point was when we opened the Gamma Knife and began treating patients there. Dr. Lesnick's support was very influential in the program.
Shortly after I got here, Bill Downey came to me and said, we're considering investing in building a Gamma Knife radiosurgery device here at Riverside, and would I support it? I said I would gladly support it, but I also told them that I didn't think it was a good idea. My skepticism proved to be very unfounded, because probably the addition of the Gamma Knife and then a device called the Synergy S really helped define us as a place where people could be treated and receive what at the time was the best treatment available anywhere in the country, for that matter in the world.
I think another turning point that involves both the physician and technology is with Dr. Frank Sanderson.
He was a go-to radiologist. We would grab a stack of films, and if Frank was there, you wanted to go into Frank's office. Frank's academic mind didn't stop there. That's why he went to UVA late in his career to learn the budding field of interventional radiology.
And that was when our stroke care really sort of took off, and we worked to the point where we are now, which is as a comprehensive stroke center.
When I look at the breadth and span of neurosurgery subspecialization, the diversity within neurology. There's now subspecialty neurology hospitalists. It's just fascinating. It really is a team that is willing to embrace people of different specialties and different backgrounds as long as they're unified on the focus on the patient. That is what it takes to make this a neurosciences effort and not a single discipline effort. We are wide and strong, not simply narrow and strong.